Your voice, your views, your vision.
The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and as always, we encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. And we promise to do our very best to keep you medically informed and healthy by discussing the medical topics that are of interest to you, our viewers. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing how to accomplish the most important, if not life-changing, goal of staying healthy.
Yes, Errol, staying healthy really means taking good care of ourselves by understanding and being actively involved with our own health care. Joining us this evening is Dr. Isaac Dapkins, Medical Director, Ambulatory Care. Dr. Dapkins is a highly experienced physician that has an excellent understanding of health care from the perspectives of both the patient and the provider. I am sure he also takes pride in Bronx Lebanon's recently completed Health and Wellness Center and his key role as its medical director.
Now, before we hear from you, Dr. Dapkins, let me once again encourage you, our viewers, to call in with any questions or comments that you may have. The number to call is 718-960-7241. And please call us. Now, let me start the program, Dr. Dapkins, by asking you to really share with our viewers and describe the ways in which they can take a more active role in their own health care.
Thank you, Mr. Schneer and Dr. Gums, for having me here. It's my passion to engage patients in their own health, and there are really two areas where you can be more involved in your own health. One is being healthy or maintaining your wellness,
right,
and the other is in taking care of your own chronic illnesses. That's the reason why I'm here tonight.
Okay. Expanding a little on Mr. Schneer's question, why is it important for the patient to be involved in the process to begin with? In other words, what are the benefits of being involved? Why should I be involved in my own health care? You should be taking care of me.
I think there is a new way of practicing medicine. Sort of in the 50s, the doctor would tell you what to do, and you would leave and just blindly follow their instructions. Nowadays, medicine is very complicated. There are a lot of new things that come and go. There are interesting diets. There are health practices. And so it's really an important component when you go to see your provider for you to understand what it is that the provider wants of you. And so I'm here to talk to you about how a provider should be trying to engage you in taking care of your own health and your own illness.
Now, how do you exactly work with patients, or you and your staff work with patients to establish their goals? Is it a personalized approach? What type of approach do you utilize?
So it's very dependent on why a person is seeing a provider, a doctor.
Right.
So I'm going to use diabetes as an example. Diabetes is a common illness that we deal with. We're asking that our doctors ask patients what they would like to work on while they're between the time that they're there and the next time. One option might be taking their medications. And so we're asking that our providers ask patients if they understand what medicines they're taking and then we provide them some feedback on making sure that they take their medicines correctly. Another example, and it's one other key thing that I want people to understand, there are certain numbers that doctors use, and we would like our own patients to know their own numbers so that when they come in, they're actually asking doctors for help with those numbers.
What are the barriers that patients can encounter or must overcome in the health and wellness process? Because I think this is not as simple as you're making it.
It isn't. So I'll give you an example. I just threw out the word numbers.
Yeah.
When I'm thinking as a doctor, I may be thinking about your blood pressure or a blood test called a sugar level, a glucose level. Many patients may not entirely understand what the doctor is talking about. And so by asking a patient to take ownership over their own numbers, their sugar level, their own blood pressure, we hope that they will come back the next time and ask for help in getting to achieve healthy outcomes.
Now, perhaps expanding on what Dr. Gum said, now would be a good time for us to discuss just what is the Health and Wellness Center that you're the director of. And obviously the term health and wellness certainly lends itself to our discussion this evening.
Sure.
How is it contributing to the health and wellness process?
So I'm very happy to announce that this past Monday, not today, 1 week ago, we did in fact open on Mount Eden Parkway, 199 Mount Eden Parkway, the new Bronx Care Health and Wellness Center.
Right.
That center is designed for improved patient flow. We hope that our patients will come through quickly and have time to spend with their provider to work on these goals. At the end of the visit, we're focusing on helping patients understand their next appointment, what the medications are that we would like them to be taking, and when we'd like them to come back. These are key components of self-management for our patients.
So the building itself is, and the doctors in it are enhancing this whole patient partnership process with the doctor.
The intent is, by improving our flow through the practice, we will help engage patients in managing their own health.
Right.
This is a lofty undertaking.
Yes, sir.
In terms of the health and the facility, describe again for me how you can accommodate this influx of patients in a way that satisfies the patient.
So our goal is to make the arrival process very quick. We actually have brand new kiosks, a system that allows you to quickly check in. And when we get you upstairs, we have a team of a nurse and a doctor who help assess you, make a decision about your treatment plan, and ask you if you understand what that plan is. We're going to help you decide on certain things that you would like to achieve for your health. For example, what weight you'd like to be, what your blood pressure should be. If you'd like to exercise more, we would help you to achieve a plan around those goals. These are very general processes, and I'm really focusing on primary care and chronic disease management like diabetes. But the intent is to expand on that over time.
Now, what happens with these kiosks when the patient walks in? Does a name come out, or how does it work?
So we, in advance of your showing up, we prepare for you. Right. And when you arrive, we ask you to identify yourself by saying what your name and your date of birth is. And once you do that, the kiosks does admit you into the practice for that day.
Right.
And it bypasses you having to be online.
Right. So one could say it's very similar to what happens in an airline when you're checking in.
Yes. Although we have some more people there greeting you when you come in.
Okay. Now, we've spoken about the process itself. What about some of the key diseases? You mentioned diabetes, but what about some of the key diseases that are impacting our community and which the Health and Wellness Center will be addressing?
So I think it's very important to remember that although we hear a lot about various different illnesses, really the key core illnesses in our community haven't changed very much. High blood pressure and death from heart disease is a very common problem in our community. Diabetes, which contributes to those, also is very common. So our focus is on helping people understand how important it is to reach certain goals. An example for blood pressure might be that my blood pressure needs to be 140 over 70 or lower. And if I am able to engage you, my patient, in that number, you might check it at home and come in and say, I wasn't reaching my goal, can you help me? And then I might give you another medicine.
If I'm overweight,
Yes.
how long are you going to spend with me to try to get me to my ideal weight?
We will spend as much as we can. I think getting people to lose weight is a tricky, difficult thing to do, but it involves me helping you understand how to do it and identifying the benefits for you in doing so.
And you're telling me in your health and wellness center, you have the time and the inclination to do this?
We hope by having a better and improved flow that we will actually have more time to spend with our patients to do this.
Okay.
Okay, on that note, let's pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
I was just about to say.
In this year of neonatology, we recognize the extraordinary and successful life-saving efforts of our neonatal team. Every day, they are truly making miracles happen for the tiniest of babies.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention, they can live their lives to the fullest as healthy young adults.
We care for each of our newborns as if they were our very own, including educating parents and assisting them in navigating the new journey with their child.
Seeing is believing, particularly for Norma Rodriguez and Raul Velasquez, the proud parents of triplets Nyla, Nilani, and Nayeli, successfully delivered by Bronx Lebanon's high-risk obstetrics team.
Gently, very good. Okay, very good. Number three out, beautiful, very fine.
Triplets are a rare occurrence. The baby girls were delivered by a C-section in excellent condition. They received follow-up care in the neonatal intensive care unit because of their low birth weight.
And when it comes to follow-up care for these triplets, as well as other neonatal graduates and newborns, Bronx Lebanon's pediatricians are making sure that they receive the necessary support.
During the first year of life, we check a child's growth, their development, and give all the required immunizations. It's a great joy to us that we're able to tell parents that they have a healthy child.
There are times when premature infants have swallowing, hearing, or breathing issues. That's when Bronx Lebanon's ENT specialists are called into action.
Our physicians, audiologists, and speech-language therapists work closely with neonatologists in assessing these medically fragile babies. When necessary, we correct the problem and also instruct parents on using safe feeding practices.
Vision is equally important for newborns.
In premature babies, the retinal blood vessels are at risk of developing abnormally, which can lead to blindness. We are one of the first hospitals in the nation to offer laser treatment to correct this condition.
The bottom line is that Bronx Lebanon is always there for its newborn patients and their families, as well as for the community. Its ER is a perfect example.
Our adult and pediatric emergency departments see more than 137,000 patients annually. We respond effectively to problems related to newborns, children, teenagers, and of course our adult and senior citizen population.
Bronx Lebanon also continues to lead the way in anesthesiology, dentistry, family medicine, medicine, neurosurgery, orthopedics, pathology, psychiatry, surgery, radiology, nursing, and long-term care. Its Bronx Care Network, including a soon-to-be-completed 9-story ambulatory care facility, as well as a new life recovery center for individuals that suffer from chemical dependency, is fulfilling Bronx Lebanon's role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions that you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now, before we continue our discussion, I understand, Dr. Gums, that we have a caller.
Yeah, we have Laura on the Laura, can we have your question, please?
Yes. I'd like to know what are the hours of operation of this new health and wellness center, and are there evening appointments as well as Saturday appointments?
Good question.
Good evening, Laura. We do have operating hours that are, I believe, from 7 to 7. We are open to provide evening and weekend hours for general, specialty, and primary care.
Very good.
Okay,
Thank you.
And you're open on Saturday as well?
Thank you for the question.
Saturday also.
Okay. Okay, now in terms of continuing our discussion and moving back to the Health and Wellness Center, Dr. Dapkins, can you share with our viewers some of the services or the services that are offered at the center?
Sure. It's a spacious, modern facility that really, it's a pleasure to walk into. So I really encourage people to come and have a look at it. We have primary care adult medical services. We have women's health services, specifically GYN. The obstetrics is in the hospital. We have specialty medical. We have a variety of adult specialty practices there. And then we have surgery and specialty surgery. Actually, Dr. Gums is going to be on that floor. We have a laboratory on the 5th floor for blood draw, and we have a radiology service, which is on the 2nd floor. X-ray, MRI, and ultrasound, as well as mammography. I do want to point out that we have a dedicated floor for orthopedics, and we've really expanded our urology and other specialty surgical services there. We're also expanding our specialty medical services. We have a large gastroenterology suite there, and a specialty medical service that includes dermatology.
So it's pretty encompassing.
Yes.
As far as the future challenges are concerned, how can you, or we as providers, enhance our efforts to engage patients relative to their own care? I have a problem with that. I don't think our patients are engaged enough in their own care. How can you make that better?
I think that's something that is an issue everywhere, that issue of patient engagement. So I think the first thing is to try to meet people where they are. So that whole idea of trying to work with a patient to identify a common goal is a core component to that. Some of the other things that we are doing, though, is we are expanding our ability for patients to engage with providers electronically. We've updated our website, which, if you've seen, is quite useful, informative. We have added a patient portal, which we are expanding and will be live with at the end of June.
Excuse me, Dr. Dapkins, we have a call.
Yeah, we have a call. I'm sorry, we have a little technical problem. Could you state your name and the question, please?
Yeah, this is Robert. My question is, I suffer from hypertension, and what will be the best way to monitor my blood pressure? Would be recommended to take the threshold reading?
Good question. Let's see if the doctor can answer.
So I'm going to thank you, Robert. That's a great question. So imagine, so blood pressure is something that you can check yourself at home if you get a blood pressure kit. Your provider can prescribe it for you. What's normal? Normal blood pressure is 120/70. There are two numbers. And so the goal would be to check your own blood pressure at home and write it down. And when you come in to your provider, ask your provider for help in getting to that number.
I think that's the ideal number, but I've been reading in AARP that older people can have a little higher blood pressure.
Yes.
Right? Could you at least give Robert a little encouragement if he's a certain age?
So if you're over 60 and all you have is high blood pressure, there's an updated guideline, and that's called the JNC8. You can look it up. It basically says that we can accept a higher blood pressure now. If you've so that number is now 150 over 90, which is a surprisingly high number. But over age 60. Now, if you have diabetes, or if you have had a heart attack, or you have heart disease, those numbers are lower, back to the way they have always been.
Thanks for the question.
Right. Now, in this age of computerization, which you were discussing, how are you and the team truly capitalizing on this unique information and communication vehicle? So you mentioned the patient portal, for example.
So I think the key piece right now is trying to make sure that people understand what it is the providers are thinking about. So there's a summary of the care that is done now, we expect providers to do, which has the diagnosis that we see you for, the medications we want you to take. And that information will be posted to our portal, and when you log on, you can see each time the provider sees you what they were treating you for.
This is something that I've discussed with you before, though.
Yes.
Okay. Okay, patient safety is always a top priority. How do you see patient engagement improving health outcomes?
I think the most critical area that patient engagement can improve patient safety is around medications. You know, a lot of times patients don't know what medicines they're taking.
And why?
Well, because...
And wives, I said.
And their wives don't know what medications they're taking, exactly. Those, so having the list of medications leave in your hand really helps start the discussion better. So you can take a list of medicines home and you can check to see whether the medicines that you have at home are in fact the ones that are on the list. And when you start doing that kind of check and balance, you can identify when there are the wrong medicine on your
And you're
list.
also encouraging the patients to call back and let you know the status of their medications.
Yes.
Okay.
And we just want to say, if you call 99 Bronx, there is a mechanism for you to get through to your provider, leave a message, ask for a refill, and we really focus on that.
Okay.
Right. Now, positive health outcomes are certainly what you and your Bronx Lebanon team strive for.
Yes.
In terms of some of your patient success stories, which we often ask our panelists, can you share some with our viewers? I'm sure with the 1 million outpatient visits, there are almost as many success stories.
I'm going to give you an example. A patient that I know, I won't identify him, a large, strong man, almost well over 6 feet tall, well over 200 pounds, who did not want to check his own blood sugar because the needle hurt. And
I can relate to that.
So we worked with him. I worked with him for a long time trying to figure out why he wouldn't check his own sugar for diabetes. And when it turned out that in fact was the reason, we worked out a solution to get a different machine to check his sugar. Working with that and his goal to use ginger to manage his diabetes in a wellness manner, he now has successfully managed his own diabetes.
Just going to stop you for 1 second. We have another call.
Yes. Could you give us your name, please, and the question? You hung up?
Okay. No, we had to hang up. So continue with the success story. We apologize.
I just want to point out that the way that we were able to engage this gentleman was by accepting his desire to use ginger to manage his health and to find a different glucometer machine that didn't hurt as much. The two of them working together has very significantly reduced his blood sugar.
Good. Okay. Call is back, or we lost it? Okay. Diet and smoking are constantly tied to all types of diseases, right?
Yes.
Can you further expand on the health issues that are directly related to diet and smoking?
So the health issues that are directly related to diet and smoking are the issues that are common in our community. And those, again, are heart disease, and I would add emphysema, or lung disease, as well as cancer. The diet that we offer is individually tailored and would be dependent on seeing a nutritionist and working with your primary care provider.
Just a minute, we can continue. Can you give us your name, please?
This is Mark from White Plains.
Mark from White Plains. Okay, you have somebody from Westchester. Come on.
Okay.
Yeah, what's the question?
Sure. My question is, how often should someone, consult their physician in order to stay on top of their health?
How often?
Thanks for the question, Mark. It depends on how old you are. So the recommendation is at least once every 1 to 2 years when you're in your 20s to 30s. It's really recommended annually. The key would be to know some of your own numbers. What is your cholesterol? What is your body mass index? And then to focus on some basic elements that have to do with your wellness. Are you exercising regularly, 30 minutes, 5 times a week? And do you use tobacco? These are the sort of basic elements of wellness that we would discuss with you.
Thank you very much for the question, Mark. That answers your second question there about smoking.
Yes.
Right?
Now, what types of advances do you see occurring in the medical field, particularly in terms of those that will potentially reduce the need for ER visits or even hospitalizations?
So, Mr. Schneer asked me about potential advances for improving health outcomes in the long run. I think, the advance that would help us the most would be some way to get patients on the same page as their doctor. I think there's a lot of speculation on how to do that right now. One is using a patient portal, another is using mobile phones to try to help people take care of their illness. My feeling is it's sort of gumshoe work, straight old doctor-patient relationship work. There are new medications coming out, new ways of improving your health through exercise, but I think for us it's going to be critical that we engage our patients.
Okay. In the time remaining, can you briefly share with our viewers your recipe for maximizing patient engagement and staying healthy? How are you going to implement all of these grandiose ideas? Which are laudable.
I think the first is engaging the medical staff. And that is something that I've worked on now for a long time, and many of the providers work with me on that. And I think we have come a long way. Providers really see the benefit. In having that discussion and spending that time with the patient. I think the second component has to do with figuring out ways that patients respond to those questions and trying to maximize on those responses. So, for example, if we find that certain diets work better in our community, we want to focus on those diets.
That ginger, I'm a little intrigued by the concept of ginger. Where does that fit in?
Ginger is it's a naturally occurring root, but it does have anti-nausea effects, and it has been shown in some areas, not in controlled trials, but to bring sugar down slightly.
And on that note, we thank you, Dr. Dapkins, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call our physician referral service by dialing 718-99 That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week when we'll be discussing the importance of the perioperative process.
In looking to the children, our future, we take pride in the new...
Maybe he's really focused.
Maybe he likes spinning the wheels.
...pavilion that is nearing completion.